All right, so I'm here today in Dallas. A lot of you know I had a little tooth mishap when I was in Thailand. I broke a tooth while at sea, so you got me thinking, what happens if it was worse? I mean, there wasn't any pain or anything like that, so what happens if I'm out there sailing and it's worse? There is pain and I'm days or weeks from being able to see a dentist. What do I do? So I scheduled an appointment with my dentist, Dr. Ashley Bristow, here in Dallas with 21st Century Dental, and she took care of me today, and so I did a little interview with her to inform you guys on what you should have and need to have on board to better prepare yourself for any kind of dental emergencies that you might have while at sea. Alright guys, here today with Dr. Ashley Bristow and 21st Century Dentist. In hindsight, it would have been better to do the interview before she worked on me, but now my tongue's a little numb from all this, so anyway. She is, my dentist has been for a few years now. Full disclosure, we used to date, but anyway. I wanted to sit here. How you doing?
I'm doing well.
Thanks for working on me today.
You're welcome.
Kind of an interesting thing, I think, most people sailors is, what happens if to take care of yourself with the dental needs as you're at sea, because a lot of times we're a long way from being able to see a dentist. So just as far as my last thing, I broke a little tooth and it wasn't hurting or anything like that, and I thought I was doing the wrong thing by filing it down, but you say it's actually a good thing.
Yeah, you're not going to do too much damage to your enamel with a nail file.
Okay, just general hygiene, I guess, for for people. What are your recommendations? Just general hygiene for people not at sea, just your average person. What do they need to be doing every day?
They need to be brushing twice a day for 2 minutes each time. Flossing at least once a day. Swishing with mouthwash is always a good idea.
Okay.
And those are pretty much the basics.
Yeah. Okay, so now say you are at sea and I'm going to be a week from seeing a dentist. I mean, so this last time I just broke a tooth, there was no pain, so you said filing it down. What if it broken enough that I was in pain? What should I do at that point?
In that case, you have to make sure you've got some certain things on board. So, are you prepped with dental things on board?
I don't know. What do I need on board?
You will be.
Okay, I will be.
In a bind where there's a hole that's big enough to need a filling, you can either use temporary cement, which you buy at the store, or if you're really in a bind, you can use sugar-free gum and just patch it up so at least the nerve isn't exposed. 3 to 4 ibuprofen every 4 to 6 hours. And then there's Anbesol that you can get at the drugstore that will provide some relief as well.
But temporary cement, is that a dental thing, or is that just where is that? What is that?
That is in the toothbrush aisle at your store. Yeah.
Okay. So should have that stocked up. And as far as what if there's like an abscess tooth or an infected tooth or something like that? How do I treat that if I'm a few days away from or a week from being able to see a dentist?
Okay, well, first and foremost, I hope everybody does this, is have antibiotics on board.
Okay.
Do you have a stash of antibiotics?
I do.
Okay.
I do.
So once you start feeling pain, swelling, redness, you'll want to go ahead and start taking antibiotics.
So what kind of, I have a bunch of Cipro.
Okay.
Is there a certain type I should have?
A Cipro will work great.
Okay.
I always advise if you're not allergic to penicillin, take amoxicillin. If you are, then take a Clyndamycin. Those are kind of your basic antibiotics for dental flare-ups. And
so, I mean, I know that like an abscess tooth and an infection can be pretty serious, and people, I think you can even die from it untreated, right? So, I mean, say it's a 2-week passage and it happens in the middle of it and you're a week from getting to land. I mean, is there anything? I mean, I guess the antibiotics is the only thing you can do, right? Or
the only thing you can do unless you can figure out how to pull your own tooth.
Oh, no.
Which I wouldn't pass it by you to do that.
No, I would not want to do that. I've had a tooth pulled before with very little anesthesia, and that was not much fun. I can't imagine doing that at sea, trying to do it yourself or have somebody else do it.
No, please don't.
Okay.
I'll get another photo sent to me of just blood and gore.
Ew, no, I don't want to do that, so. All right, so what are things that you recommend that I haven't thought of there? I mean,
so you always want to start off any trip by going to see your dentist first.
Okay.
If you have any sort of cavities, things that need extractions or root canals, it is hands down it will flare up while you're gone.
Right.
Because that's what happens.
Right.
So get all of that taken care of in the all clear before you leave. Get your antibiotics. Your dentist may prescribe those for you if you're really nice.
Okay. Right.
And then also, I would recommend getting fluoridated toothpaste.
Okay.
Because you're out at sea, you're drinking your beverage of choice, especially you.
Me? What are you talking about?
Yeah, just, a little beverage here and there. So that sugar and the elements that are in it continuously washing over your teeth is leading to more acidity and the breakdown of the enamel. So if you have a fluoridated toothpaste, it will help to have strength to it.
Is that not, like, I just assumed that was standard in toothpaste, or is it not?
It typically is, but with the habits of a sailor,
okay,
I would want to hit it with something a little harder than just Colgate.
Okay.
So that's why. But yes, any sort of fluoridated toothpaste will work.
Okay. And what else, sir?
Then going to the store, moving kind of from prescription to just basic things at the store, I would recommend buying sunblock, obviously sunblock for your face, but also lip balm that has certain SPF in it, the highest you can get. One of the biggest triggers of cold sores is actually sun and stress, both of which are going to happen on a boat. And so if you break out in cold sores, it's obviously going to be very uncomfortable. So I would have some abreva, and then some aquafor for just more moisturization. Another thing that can happen with lots of sun exposure is something called angular colitis. And the corners of the mouth actually get really dried out, cracked, and as much as you doctor it, it doesn't feel any better. So what happens is there's a yeast infection that can form there. I mean, there's bacteria all over your body, so anything can happen there. So actually, when you're at the store, pick up some monistat.
Oh no, really?
Yeah, you can be ready for anything. Don't be afraid to get into that aisle, Bobby.
Okay, thanks.
It is what it is. Then also, of course, as a sailor, you're going to have anti-nausea medicine on board.
You know that.
Yeah, but the acidity from your upset stomach and everything being expelled, washing over the enamel multiple times, is going to start to thin it.
Okay.
If you do have somebody on board who is consistently sick and those don't seem to work, have some baking soda, mix some baking soda and water after the attack. After they expel. And the baking soda and water will actually neutralize the acid.
Okay.
Because you don't want to brush directly after.
Right. Oh, okay. I guess you don't want to. You said you don't want to brush direct, because a lot of people, if they've been throwing up, they want to get a little maybe fresher breath.
Right.
And so you say don't brush right after though.
Don't brush for at least 15 minutes.
Okay.
The acidity is sitting on the teeth, or the acid is sitting on the teeth, and brushing it is just a mechanical way to kind of rub off tooth structure.
Okay.
So neutralize it, or at least wait 15 minutes. And if you want that minty taste, switch to mouthwash.
Okay.
A lot of times people will fall and break a front tooth.
Okay.
Or you get hit by is it called a boom?
Yes.
Yeah. There we go. Get hit by the boom.
Right.
Break off a front tooth. If you do that, of course, it's going to be super sensitive.
Right.
And then a lot of times you'll actually see the nerve, which is the part that bleeds.
Right.
I would also have some eugenol on board.
What is that?
It's a little liquid you can buy at the store, but it's just basically it soothes nerves.
Okay.
And so you can dab some of that, and you can do that on a cavity as well, but the cavity's not going to go away.
Right.
So with a breakage, it's a little more indicated for that. And then you kind of just have to look like a pirate with no front tooth until you get to a dentist.
Right. And I guess I'll get a list of all these things to put down in the show notes below, so you can get, eugenol. I don't know how to spell that, so she'll tell me how to put that on there. So we'll do that.
And lastly, I would say to get a mouthgaurd.
Right.
Right. You have one that you don't use, so that's going to be on the agenda.
Right.
You can just get one from the store. You don't have to get one from your dentist. And that a lot of times has to do with your sleep pattern. You're sleeping above deck, below deck, different positions. Sometimes one of your videos said you slept for an hour every other hour.
Yeah, not even that much, yeah.
And so, your jaw's just in a bad position.
Right.
So as you clench and grind your teeth at night, or in these small amounts of sleep that you do get, there's a high likelihood they're going to start to fracture, in which case that would lead to pain.
Okay.
So that would be more proactive, but everything else is, just smart to have on board.
I was in Thailand when I broke my tooth, and I could have gone to a dentist there. Is there anything you can recommend as far as like seeing a foreign dentist to know their qualifications and everything?
It's so across the board. I really don't have any recommendations specifically.
Okay.
There are a lot of countries that have very poor dentists, and I see a lot of dental work come back to me that needs to be fixed.
Okay.
There are a lot of countries that do a good job.
Right.
And so it's just hard to say.
Okay.
I'm assuming they don't have Yelp in Thailand.
You know what? I don't think they do. They had TripAdvisor, but not Yelp. So.
Well, if it's comprehensive enough, TripAdvisor would have a dentist.
Okay. All right. Anything else there, I guess?
I don't think so. I think that's what a sailor needs to get across the ocean and deal with a dental emergency.
Okay. Well, thank you for seeing me today. I appreciate it.
You're welcome.
And so it's 21st Century Dentist. There'll be a link down below if you want to see her here in Dallas. So they have a pretty nice office here. And I guess you've been my dentist for 3 or 4 years.
Mm-hmm.
So I guess, although it's been, how long has it been? It's been over a year, probably 2 years. Since
2.
Over 2. So anyway.
So don't follow his lead.
Right. Oh, so as a dentist, how often should you get a cleaning and everything?
Every 6 months.
Every 6 months.
Mm-hmm.
Okay.
And then, of course, that goes for your checkup too. It's not just that you want your teeth cleaned.
Right. Okay. All right. Well, thank you very much.
All right. Thank you.
All right. Okay, guys, just an update and a couple quick announcements. Pretty exciting stuff coming in the future here. I just got back to Dallas for a couple days here to kind of get some things together, and then I'm headed to Vancouver to get on the new boat and start sailing that. It is a 51-foot Beneteau Oceanus. The guys at Gulf Charters and Island Spirit Catamarans, it's their boat, and basically I'm going to be sailing it for the next 10 months. I'm going to get it over to Thailand for them by the end of August next year. But in the meantime, I get to sail it and have a lot of fun on it. So it should be a great boat. We're going to work down the west coast of the United States, end up in Cabo by the end of October, and then in March we're going to cross the Pacific and head over to Asia. So it's a lot of cool stuff there. And we're actually going to be inviting you guys, if you'd like to come join us, go to sailingdoodles.com, and under the tab Sail With Us, it's got more information on how you can sail with us. Also, we're going to be doing another Patron Drawing. We had a winner last 2 weeks ago. He said he's a little too busy to be doing that right now, so we're going to do another Patron Drawing here in about 2 weeks. So if you're not a patron, you can become a patron for a free chance to join us on the boat. Also, we have some swag. It's pretty cool stuff. T-shirts for sale. There you go. You can go check them out. Go to sailingdoodles.com and check out the swag tab, and it'll link to the t-shirts. I think they're pretty cool. I've actually ordered 4 of them for myself, so it should be pretty cool. And also, we have a new crew member joining. Her name is Laura. She was actually in episode 24. If you want to go back and watch that, I think towards the end she was in that. Very good looking girl. But here is a picture of her. Well, she'll be joining us on the boat early November. So it's a fun time, exciting stuff ahead. So, all right, guys. Hey, will you do me a favor? Like that little thumbs up button there at the bottom, will you click it? Please click like and subscribe. It really helps.